Hi, everyone. Dr. Frankie here today. And I want to give you a reminder really quick before I jump into things, which is I just got out of, I call it my booby smashing appointment. I want to encourage you, if you're 40 plus, to go and get your mammogram. It's not terrible. I remember for years people would say it was absolutely horrible, so painful. It really isn't. And it is so important prevention to avoid breast cancer. Nobody wants that, right? So get in there, get those screenings done, nothing to be afraid of. And yeah, so I just wanted to put that out to you all. Our health is so important and we need to invest in it. So, okay, that's enough for my PSA announcement. The other thing I want to say is that if you have not visited welcometovenus.com and downloaded your free app, which is time limited, it will not be free forever. I want to remind you to get on there and download it. Welcometovenus.com is where you can access it. And you can also submit questions like these. So I want to keep doing this. I love being here with you all, and I need these really awesome questions from you. So get on there, download it, sign up, and let's keep things rolling and keep the questions coming. So I'm going to jump in. I've got my first question today from Jenny. I was recently diagnosed with relationship OCD, which is interesting. I immediately am thinking, is that a TikTok diagnosis? Because that's not in the DSM. But I get it. Sounds like anxiety related to your relationship. And it's been really confusing and stressful for both me and my partner. I can't always tell what's a real concern and what's just my brain spinning out. Sometimes I worry my partner isn't as into me, or that something they said or did means more than it actually does. And it turns out, it turns into arguments over things that might not even matter. I feel guilty every time because I don't want to accuse them or create unnecessary conflict. But my OCD keeps blurring the line between intuition and obsession. How do you learn to trust your partner and your instincts without letting OCD turn everything into a fight? Yeah, so that's great. First of all, I'm sure you already know this, Jenny, but I want to say for those that are listening, OCD is basically anxiety. It's like an extreme form of anxiety, and it's absolutely treatable. And you can treat it through, there's several modalities. One, which I always say is the best, go to see a therapist who specializes in anxiety disorders. And even, OCD, somebody who specializes in OCD would be excellent, but usually anybody who would specialize in OCD, they would usually just say anxiety disorders because they know how to deal with phobias and all sorts of there are different ways in which we experience anxiety to different varying degrees. So that's number one. Number two, there is medication, pharmacotherapy that you can use to help reduce the rumination and the way in which you describe your brain spinning out of control, which is rumination. It keeps going again and again on loop, and maybe even gets escalated and exacerbated the more that it's on loop, and starts to make up false narratives, stories, distorts the reality, and it starts to spin out of control, which, as you're experiencing, wreaks havoc on your relationship. So if you need something quickly, which I call it stop the bleeding, you can get a recommendation from your primary care physician to see a psychiatrist who can help you reduce your OCD related ruminations and behaviors. And in the meantime, see a therapist. Don't just go and get pharmacotherapy without also seeing a therapist. A lot of psychiatrists won't even prescribe medication without you being in weekly therapy anyway. But just want to make sure that you consider that because it needs to be done together. So there's that. That's going to help immediately. But the longer term plan, if your diagnosis is OCD, then you want to treat the way, like your thought structure. So you might want to look into a cognitive behavioral therapist to look at what your your schema is, what your basically there's distorted beliefs that you're holding on to and sometimes misinterpreting situations or statements, things that are communicated to mean something other than what they do mean. And there may be a little bit of attachment stuff too. So therapy. I mean, I don't have enough time to go into more details, but basically you want to look at how you're thinking about it, what your perception is, what your mindset is, and how you're regulating your system. So, and that all starts with seeing a therapist on a regular basis. So let me just, how do you learn to trust your partner and your instincts without letting OCD turn everything into a fight? Starts by going to therapy. That's my best answer I can give you right now. Thanks so much for writing in. Good luck. We want to hear how that's going. My girlfriend and I live not just in a community that does not accept us for being queer, but we also both come from families and cultures where it's not accepted at all. Being queer here feels lonely. How do we keep our relationship emotionally nourished when we can't be out where we live? So May, this is so, I mean, you touch on such an important point, which is it's hard to thrive when we don't have community support. So if you don't have access to people in the LGBTQ community where you are, you got to figure out with technology how to connect to community. So it could be a social forum. It could be something that's through Zoom. Like for example, I'm a CEO of Little Gay Book, and we have pride dance parties virtually. We have all sorts of ways to connect people virtually, keeping folks like you in mind where not everybody has access to community. So that I would say is the best thing that I can suggest right now. I have had clients too through the years actually relocate, move to an environment, to a city where they can be around their people that look like them, people that, you know what I mean, they can feel safe with, people that are familiar. And that would be people in the community. So it's so hard to live in an area where you don't have people like you. Really isolating, really lonely. And the best bet right now is lean on technology, utilize it. It's out there. There's tons going on that's LGBTQ plus related virtually. Thanks for writing in. Carmen, I have been with the same woman for a long time. Everyone sees us as a lesbian couple, which of course I understand, but I identify as a bisexual person and sometimes feel like I am judged if I say I'm bi when someone calls me a lesbian. How can we honor both my queerness and my full identity in our relationship and within our lesbian circle of friends that I think still hold some judgment on bisexual people, like we're going to turn at any moment to men? Carmen, you're touching on something that I have battled with for decades. And really, it stems from fear and misunderstanding. There is this assumption that if you don't identify as lesbian and you identify as bisexual, even now, pansexual or fluid, that you are somehow less loyal, not able to be committed, want to straddle both fences or straddle both sides, that you are greedy. I mean, I've heard so many things, that you're dabbling, you want to eat your cake and have it too. None of that is true. This is about the range in sexual orientation. And some of us just aren't only lesbian. Some of us just aren't only gay. Some of us are bisexual. Some of us are fluid, where it just can range. It's not, and they're open not to just cis men and cis women. They're open to trans people. So there's all sorts out there. But we're sort of given this idea that if you don't perfectly fit into a box, that there's something wrong with you. And there's nothing wrong with you. So continue to stand confidently in who you are, because you are beautiful just the way that you are. And you are setting an example. You are a role model for people to see that you can certainly be in a committed relationship, same gendered relationship with somebody, and choose them every day and stay faithful and loyal, while at the same time be bisexual. It's a choice that we make when we're in a relationship. It doesn't mean that once you're in a relationship, whether you're straight or gay, that you don't find other people attractive. It's natural to find other people attractive. And it's not that because you're bisexual that you have a higher likelihood to find people more attractive. I mean, it's like you could, but my point is the choice to be in the relationship is what matters. And that's what keeps you committed. So we get it confused. People will say, well, if they like both genders, then the probability of them leaving me for somebody else would be so much higher. No, because it's about the person's character. It's not about their sexual orientation. If there's somebody who's loyal and able to be in a committed relationship and they choose you on a daily basis, and you see that demonstrated by the history of the relationships they've had already, That's what you want to focus on. People are focusing on the wrong thing. So keep doing what you're doing. Know that you're setting an example and you're courageous, and I'm doing it with you too. And I support you all the way. So, Carmen, I hope that helps. Shay, let me see. Am I doing okay? I'm like, boy, I just can talk and talk and talk. Okay, Shay. First of all, Shay, what a beautiful name. That's my daughter's name. All right. I bring big emotions. My partner shuts down. What tools help couples stay connected when one feels overwhelmed and the other withdraws? So this is such a beautiful dynamic that I'm saying beautiful a little facetiously. It's a very common dynamic where one person, it comes to, it is stemming from attachment theory. One person has an anxious attachment style and the other one has an avoidant attachment style. And it is a perfect cycle to get stuck in, right? The one with the anxious attachment style starts to cling and feel like they're being needy or maybe anxious and fearful if they're noticing some kind of slight change in their partner's behavior, or maybe they're perceiving there's a slight change when there really isn't. And then they start to pull on their partner. And if they're a partner, or because they're trying to get reassurance, and if their partner is avoidant, what's going to happen? They're going to start pull away, recede, avoid, because they start to feel suffocated. And then the person who has anxious attachment becomes more clingy, trying to get reassurance so that they can manage their anxiety and regulate their system. And you just stay in this really difficult, painful dynamic. So the way to do this is, first of all, you have to recognize your attachment style and understand that it is on each of us individually to figure out how to regulate our system. It is not up to our partner to regulate our system. It helps when they can understand what kind of system we have so that they can be supportive, we can support each other and not actively work against it. So for example, for your partner to understand that you get anxious when they pull away and they start to shut down, that what you need from them, well, you both need to set some ground rules. That if she or they are starting to shut down, that they communicate. We can't have a productive conversation right now because I'm feeling not connected to myself. I can't stay focused. I'm not in a headspace to reach a resolution. Let's take a timeout first. It's like timeout has to be part of it. And timeout means 1 hour or 2 hours. It doesn't mean 2 days. People sometimes can take advantage of that, right? And they're like, well, it's a way of stonewalling. It's a way of avoiding dealing with what's going on because it's tough. So set some ground rules and acknowledge what kind of attachment style each of you has and read up on attachment theory. So there's all these attachment books out there. There's one that's called Becoming Attached. That's really great. But get online. Also, there are tons of different attachment assessments, quizzes that are short that will give you an idea of what style you have. Start there, come up with ground rules together, communicate, and also look at John Gottman's 7 principles for how to make marriage work. Ignore the fact that it's written for like heterosexuals, because the tools and the skills are applicable to anybody, but he talks about the 5 horsemen in there. So those are the 5 things that you absolutely should not do when you are getting into any kind of conflict with your partner. They're toxic. They lead to an emotional relationship breakdown. They undermine security, safety, and trust. So definitely get that book, read that, and apply. Though, when you're writing your ground rules, be thinking about the research that Gottman and his wife have done and they've offered us. And it's it's gold. It's so helpful. Okay. Thanks, Shay. Tony, I've been a stone butch in my relationship since my partner and I got together in the early 90s or the 90s. I know I'm older, but the only time I have ever had an orgasm is when I masturbate. I feel like my own sexual desires have changed over time, and I haven't even told my partner as I am afraid she will see me differently. But I would like to experience intimacy with her now and have her touch me, and I'm afraid to bring it up. Help. So, first of all, I just want to say, Tony, you're so brave to, put this question out there, but it's an important one, and you're not alone. If you grew up, you've been stone butch in a relationship since the 90s. I mean, I think also just in terms of the way that our society talks about sex and sex positivity. Back then, there was a lot of just shaming and repression and avoidance, misinformation, things like that. So it starts with communication and being open about it. I mean, you want to make the intimacy better in your relationship with your partner. So I think that they will be hopefully receptive and excited about your interest in building on what you already have. And see how they feel. It may be surprising to them. So I would encourage you to kind of welcome all the reactions that come up on either side. And before you even start the conversation, make sure that you discuss the fact that there's no judgment or criticism. That's really about learning each other and recognizing too that people change, we evolve and we grow. And sometimes, I mean, it's a beautiful thing that you were stone butch and now you're wanting to expand your sexual experience. And because it's also, that's letting go of control. And I think that is something to be celebrated, where you're willing to be more vulnerable and you're inviting your partner in on that journey. So hopefully they can celebrate that with you. And if for a while you need to masturbate, on your own to get off, like that's fine too. Like there's no one way to do this. I think this is really something to get excited about, really. I don't see any negative here. So let us know how that goes. We'd love to hear from you. And thanks again for submitting that question. All of these questions are fantastic. I appreciate you all. Thanks for being here with me. And I will see you next week. Kisses, hugs. Take good care, everyone.